Help us understand, and you are the CEO of the exchange, but you also have looked much more and are looking much more broadly at cost drivers. What's going on here that's driving year over year double-digit average increases?
So this problem of ever increasing healthcare cost is much bigger than the exchange, and we're feeling it heavily in our market. So the major cost drivers out there we know are hospital costs, pharmaceutical costs, are two of the biggest examples. So there are broader efforts that the exchange is involved in to address those ever-rising costs and move towards the goal of our benchmark set for our state, which is 3% per year increase. And as you said, we've had double digits in the individual market. So prices, the thing to know about prices, if people are out there and they maybe meet one of those criteria that I described, is prices vary based on age, income, geography, in our market, can vary widely. And I think the key thing that is important is so many of our customers, 80%, are eligible for the federal premium tax credit, which is massively reducing people's costs and has been a very helpful driver to keep people covered.
What is the Insurance Commissioner's Office said a key driver behind these rates is the increase in services used and the cost to deliver that care. Does that just mean people are using their insurance more, going to the doctor
Let
more?
me just say it more simply. So healthcare, the cost of healthcare, what's driving healthcare costs are utilization and price. So in terms of utilization, we want to encourage utilization for preventive services like primary care. There is some low value care that has been identified that there is some care that we could be avoiding, but primarily the most important mechanism to get around to reduce healthcare costs is around price. So our public option plan, first in the nation, and we're very grateful for Governor Inslee for supporting that, does that through what's a reference-based pricing mechanism, basically setting the aggregate price at an aggregate percent of Medicare.
Talking about Medicaid enrollment trends, let's talk about cost trends and what's driving costs, because that was the other piece of this national survey. Declining overall Medicaid enrollments, but we're seeing prices go up. What's driving that?
Maybe, and I don't mean to be flippant, but what costs aren't going up? I think we're seeing, a large increase in the price of prescriptions. That said, there are some tremendously effective breakthrough, amazing therapies out there that are expensive. They may be one-time or two-time drugs, $2 million to cure sickle cell disease. That's phenomenal, right? I think there are other new cancer treatments that are very expensive. So I think pharmaceutical costs certainly have gone up. I can't tell you the trend off the top of my head. And we know from our hospital partners that they continue to feel the strain of the pandemic, and that costs for them in terms of assuring adequate workforce and labor with provider shortages, nursing shortages, home care worker shortages, have also, created a demand for workers, and so they're having to pay more prices to get that small workforce to where they need them. So I think it's a combination of things. I think the price of medical, everything, inflation, everything has gone up. So I think it's more a reflection of just general increases across the board than any one specific thing.
You can check out the rest of the show by clicking on the link below or by watching Inside Olympia Thursday evenings at 7 and 10.